Why is my child's skin acting up? In this video, we are going to look at common skin conditions in children and how to treat them. I'm Dr. Joshua Derito, a family physician. I have interest in public health and cancer prevention and treatment. So our topic of this evening is common skin conditions in children and how to treat them. So skin conditions are among the top 10 reasons children visit their doctor. So up 1 in every 5 children suffer from eczema, and 70% of the children under the age of 3 experience a diaper rash at some point in their life. Then fungal and bacterial infections are on the rise in daycare and even in schools. So why is this so? So what does this mean for us? It means that parents must be informed and they must be proactive in preventing these conditions. So why does the skin matter? Then the skin is more than just the covering of your body. So what are the functions of the skin in children? Protection. The skin acts as a barrier against germs, toxin, and even trauma. Then also your skin helps in your temperature regulation. So it maintains the body heat and also cooling, a very important function of the skin. Then it helps in sensation. Your skins help you to detect pain, touch, pressure, and also temperature, and so you can take the necessary precaution, especially when you are exposed to extremes of temperature. Hydration control. Your skin prevents water loss, and so when it is intact, then you have a regulatory system to maintain your body fluid system. Then immune defense. Your skin protects you, is the first line of defense against infections, and that's why when you get conditions like burns, then your immune system is broken down and you are more prone. So the children's skin is thinner, is more sensitive, and loses moisture faster. So make it more vulnerable. And so when kids, remember the skin forms a big percentage of the body surface area. And when you consider the volume of a child and the surface area of the skin, the surface area is more. So children tend to lose more volume from the skin and they can easily become dehydrated even from minor injuries. So what are some of the skincare essentials for children? So what are some of the golden rules that you need to take care of your child's skin? Use gentle, fragrance-free cleansers, avoiding things like bar soaps. Bathe children in lukewarm water, not cold and not hot, for short periods only. Pat the skin dry. Do not rub, because rubbing destroys the skin and breaks down the immunity of the child's skin. So apply a moisturizer immediately after bathing so that you protect the child's skin and prevent it from getting cold and be able to help the baby to maintain its body temperature. Then use sun protection even for babies over 6 months so that they do not get hurt by the sun. So remember that clothing is very important. As much as possible, choose cotton clothing to reduce irritation to the skin and protect the skin from harm. So what are some of the common conditions that affect a child's skin? Eczema, or what we call atopic dermatitis. This is an immunological condition which is usually caused by allergic steam triggers. Usually for eczema to be there, then the skin is red, has itchy passes, and it often creases, and it often involves the creases of the body, like the elbows, at the knees, or you may have it at the cheeks, and you have those red itchy patches that are very uncomfortable for the child. Triggers include things like heat, wool, and even something like foods. Remember that atopy is part, sometimes could be part of a triad that is composed of asthma, atopic dermatitis, and also rhinitis. How do you treat this if your child has eczema? Moisturizers are very important, and you can use them 2 to 3 times in a day. Then you can use mild steroids on the child. And the steroids in a child, you should not try as much as possible not to go more than 5 days. If you have to use them longer, then you need the advice of your doctor. And then it is important that you identify what are the triggers that is causing your child to have this condition, and then you avoid the triggers. In severe cases, then you may need to be referred to a dermatologist. Most of the eczema can be managed by your regular health provider, but if it persists and the reaction become more severe, then you may need to see a dermatologist. Then we have the diaper rash. What is this? The symptoms are red, inflamed skin in the diaper area. What is the cause for this? It's usually prolonged moisture, the child staying long wet without change of the diaper, and this causes friction and can also cause a yeast infection. So how do you manage this? Encourage the caretaker for your child to frequently change the diapers, and then use barrier creams like zinc oxide to protect the child's skin every time you change the diaper of your child. Then allow sometimes the child to be diaper free, so that allow good aeration and the healing of the skin, so that the baby can also be able to get the natural healing from the natural environment. Then avoid baby wipes which have alcohol or perfumes, because these can be irritating to the skin, and sometimes they can cause lacerations and injuries to the skin, which we really want to avoid, especially in the diaper area. We have skin infection, what we call impetigo, which is a bacterial infection, and it presents with red sores that burst and they develop honey-colored crust. They can be all over the body, and they are usually caused by a bacteria that we call Staphylococcus aureus. Sometimes they can have pus, they can cause a cracking and the scaling of the lips and other areas of the body. So the treatment, usually you can use topical and antibiotics like like supricin, and also sometimes oral antibiotics. Keep the child home until 24 hours after starting the treatment, so that you don't spread it to other children. And then make sure that you disinfect the baby's towels, toys, and clothes when they get this infection. Then we have ringworms, or what is medically called tinea, and it has different names depending on where the fungal infection is. It can be on the head, it can be on the body, it can be on the feet. So usually this is ring-shaped scaly lesions with red patches, and they have very clear centers, and they are well defined. They can be on the cheek, they can be on the head, they can be anywhere on the body. And as I said, this is a fungal infection. How do you treat this? Usually use of antifungal cream like clotrimazole, miconazole. Sometimes if the fungus are on the body, you may need to use oral treatment, and especially if the head is involved, the scalp. So do not share combs, hats, or towels. Remember, this tinea is highly contagious, so it can be spread from one child to another. Then we have what we call the viral infections of the skin, like something we call molluscum contagiosum. This is a viral infection which presents with small waxy pearly bumps with a central dimple on the skin surface, and can be anywhere on the body. Usually they are viral infections, and they are usually self-limiting. Usually they need not be treated, and within 6 to 12 months, it will just go away. Sometimes when they need treatment, you can burn them with uh, cryotherapy, or you can use curettage, or you can use topical creams. Teach your child not to crush or pick the lesions. One of the important thing is to note is when your child has red flags presenting with the skin condition. Like if you have a rash with a high fever and the child is becoming unarousable, this could be a danger sign. Blistering or peeling, you need to be worried about this. Pus, pain, or rapidly spreading redness. Then lethargy and irritability. A child who is unresponsive or who is excessively irritable. Seek medical advice if any of these are present. So how do you prevent some of these skin condition in your child? It is important that you keep the nails short and clean so that the children do not scratch themselves and injure their skins and also introduce bacteria to their skin. Use a hypoallergenic laundry detergent so that you will avoid uh, hypersensitivity reactions. Apply a moisturizer to the baby skin so that you protect the baby skin, and also when you are in dry weather condition, is very important. Teach good hygiene early to the child, like hand washing and not scratching, and teach them to keep their nails short. Then avoid overdressing. Dress for the weather, so reduce sweat triggers. So a child's skin tells a story. So don't ignore it. So take precautions so that your child stays healthy and you maintain the skin of your child. And remember that what you see on the skin could be telling a tale of what is happening in your baby. So remember always to take care of the baby's skin so that you protect their health. And remember, the skin is very important. So early care prevents some of these conditions, and remember that also diagnosing on time then can lead to their treatment. So skin health is equal to a happier baby and more comfortable child, because sometimes skin condition can be issue, can make the baby to lose sleep, and can make the baby to be very irritable because they are very uncomfortable. So remember that if you want more tips on how to keep your child healthy, follow the overall health YouTube channel for expert child care and tips every week. Thank you for watching. Remember to leave your comment on the comment section of this video and share it within your circles. Thank you.